Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Malaria, RTK, and QMS debate. Yes, you may be wondering what is RTK. RTK has to do with malaria rapid test kits that people are advised these days to probably check their malaria parasite level, do it yourself before taking any anti-malaria drug. QMS, the QMS in itself is quality management system, and it has to do with those parameters, those important things that you have to do in order to get very reliable and have confidence in the results you are getting, especially when you perform any laboratory test. The rapid test kits are another way of saying rapid laboratory test. The debate is therefore oncoming, because when you start from the perspective that there are now vaccines produced for malaria, that malaria vaccines are available. Are they not effective? Yes, to a certain extent, they are partially effective. And they are strictly right now being used on children before 5 years of age. And even at that, should there be ongoing malaria infection, the drug treatment has to be done. But not to abuse the drug, because malaria presentation, we all know, is fever, and this is not limited to malaria. It is something that can happen with any infection, not necessarily malaria or any other presentation from other diseases. So it is therefore necessary not to abuse the malaria drug and not to misdiagnose treating malaria when it is not malaria. And so it is therefore necessary to use the laboratory to perform the test before any drug taking. But the debate is now on how effective is, or how reliable, more or less, is that RTK test that you perform yourself, and how to build your confidence. So that is where I am trying to address in this presentation, this video. If we look at RTK, the essence is more or less to just discover the antigen antibody reaction. But in a situation where the patient in itself did not produce enough antibody for you to check, or the problem, the RTK itself is not very effective to detect a very minimal level of that antibody produced, or even the antigen of the malaria parasite itself. So you now have a situation where you are having false results. But that is not limited. There is also the preparation before the test, the kind of things that usually has to be done in a QMS. The QMS talks about the pre-test, the test itself, and the post-test. So when you factor all these things into all laboratory tests that you do, that will now give you confidence to release the result. Is that done in the situation of rapid test kit that you happen to do by yourself? That is where I am trying to now make a serious demand on the training of even those who are to perform this test on themselves, so that the result they have is reliable and give them confidence that what they have done. And the further test will now be taken to the appropriate laboratory equipped enough to do further tests. But like I've always been saying, the fuller discussion, the fuller debate is in the slide section, where you will have a clearer understanding of this topic. So as usual, click the like button, subscribe for more. The outline, objective introduction, principle of laboratory test, RTK without QMS reliability, conclusion. The objective, to expose the importance of QMS for all malaria RTK tests performed in order to produce reliable and reproducible results that should build confidence in the performance of the test and external examiners or doctors in decision making. The introduction. Generally, laboratory tests for detection of malaria parasites in blood samples are done for decision making on whether to commence anti-malaria treatment or to monitor the effect of the malaria drug on the patient. Usually, if the patient's grading is reducing, whether it was +3 before it came to +2 or +1, then you know the drug is effective. But where there is no change in the grading of the positive test, that's a way of monitoring treatment. It could also be for the purposes of research, of full identification of the Plasmodium species for fuller epidemiological study. In countries where malaria parasites are endemic, the RTKs are advisable to be used by people who present with fever and other symptoms of malaria to perform the test first, and where positive, commence recommended anti-malaria treatment by purchasing the drug from the pharmacy to prevent creating drug resistance. Now, the quality management system, the QMS, is the reason why many laboratory results are not reliable, because if there are no quality management observation that they are not keeping to that tenant, it becomes a problem to defend their results. And most times, the confidence and the reliability or even reproducibility of these results is impossible. So with QMS, maintaining all the what you expected to do, the high quality needed, in terms of even equipment and every other thing you are using before, pre, post, and during the test itself, that quality maintains high standard. But in the past, quality control measures were put in place along with test samples to check the results obtained after performing the test as reliable and reproducible to build confidence in the laboratory personnel. That was what we used to do. However, this was not proactive enough because you still have some bad results, even with all the quality control, the control you set up with the test. Then we now brought in what can be done to prevent errors. So quality assurance was added to prevent especially those things that affect the collection of samples in the pre-test stage, like hemolysis would be in the sample. No matter what you do, it's garbage in, garbage out, because you have brought in the bad samples that will not give the correct result of what is happening internally in the patient. And so post-test stage, this advanced to QMS, that is from ordinary quality control, quality assurance. Then we now have QMS, where documentation is key. SOP, standard operating procedures, are drawn and corrective measures are recorded too on a daily basis. So imagine doing RTK without QMS and the debacle of reliability and confidence in that kind of results. The principle of laboratory tests. There are so many tests done in the laboratory, but you will find out that one is usually the gold standard. That is, you are like 100% sure that what you have discovered with all the QMS being upkept, what you have discovered is exactly what is happening in the patient. The first principle of laboratory test is the light microscopy, as far as malaria parasite is concerned. So the thick and thin blood smear comes from the understanding of the malaria parasite life cycle, which we examine under the light microscope for their existence in patient's blood. This remains the gold standard, allowing for detection, identification of the Plasmodium species and quantification of parasite density. Then 2 is rapid diagnostic test, which is what I'm just talking about. In the hands of the medical laboratory scientists, it is also useful and can give a reliable result. But when you are talking of people who are not trained, then that's another thing. The article relies on the monochromatographic test that detects specific antigen protein produced by malaria parasites. They are useful for rapid on-the-spot testing, and the result is usually out between 15 to 20 minutes. Another principle is the molecular diagnosis, where you use the PCR. The PCR amplifies this molecule, the DNA, so that the parasite DNA is now amplified and you have more. So it is easily, it becomes more sensitive. And there is also the fluorescent dye that is used to stain the parasite. We call it quantitative buffy coats, where you examine around the region where the parasite should concentrate, and the acridine orange stain can be used, so it fluoresces out and you detect the malaria parasite. So these are tests that requires expertise, and you can imagine all the pains the medical laboratory scientists will go through to confirm this, or laboratory personnel generally. Malaria culture and drug sensitivity tests are also useful in research when you are culturing, growing the parasite itself. Now let's look at the setback of RTKs in the hands of anybody apart from the laboratory personnel. RTK without QMS. What do you have? With QMS, low parasite density will be countermanded by molecular amplification before the test is done. But how would the person who has no experience know what to do where there is low density? There is also the species limitation, where the parasite itself is not there. The RTK cannot identify it. Then there is also the genetic deletions, where some malaria parasites lack the specific protein that the RTKs want to exhibit as line. So when it is not there, you cannot really see it as positive, whereas the malaria is there. Persistent antigen. After a successful treatment, the antigen could still be there, where you will be testing and you will still be getting a positive result. So you now feel that the person is not yet treated or is not yet cured of malaria parasitemia. Then there is cross-reactivity, when the antigen reacts with other other conditions that will now give a positive result. The kit quality is another thing that if you don't have QMS, you will not be able to detect, and will give you negative. It affects it negatively by faulty accessories such as dry out, alcohol swab, poorly functioning. All these things, the QMS would probably help you detect before you bring out the result. Then interpretation of errors. If you are not experienced in this field, you may not be able to interpret that error that you even discover. Finally, the conclusion. The debate conclusion is that what is good for the goose is good for the gander. If you are talking that the QMS is a necessity for laboratory personnel with all their years of training in their various specialties to produce a rapid, reliable, and reproducible result with confidence, then you can't not expect somebody who has no experience to now be produce a rapid results that is reliable and with confidence. So that is the bottom line. What international standard is will we use to monitor? Because this QMS, you are also supposed to have an international standard organization that will be monitoring, that you are subscribing to, that would even send external quality this thing. So what one would advise is, where the regulatory body is concerned, regulating the more or less validating that the kit is 100% going to give the result, but it has to also find a way of assessing the performer, the people who are going to the person that will perform this test on itself, to know that it is not a continuous error, wasting time and money by having a way to build confidence in these do-it-yourself patients. The solution is for the regulatory body, as I said, of medical laboratory practice to not only validate these RTKs, but also invent a way to be an external assessor of RTK users holistically. That way, the confidence will be built, and all that we want, the objective will be achieved. That is the goal of the RTK, that is not abuse of drug. Where somebody is calling himself positive, whereas it's false positive or false negative, then what are we doing? We have not corrected or achieved our goal. So there is a reason for to really train these people. They can't undergo the rigors of training as a medical lab scientist, but at least since they just want to do one test out of the quantum of tests that the medical laboratory scientists can do, then they need to do it well. Anything worth doing at all is worth doing well. So you can watch more of my videos on health matters, laboratory investigation especially. Thank you.